start with the chapter Hospital Formulary System. So first question is define hospital formulary. So the compilation of selected preparations by a hospital is called a hospital formulary. The selection is based on the evaluation of these preparations against the needs of the patients. So as per the needs of the patients in that particular hospital, actually hospital formulary is made for that hospital. So second question is write about the guiding principles while using a formulary. So number 1 point is in a hospital PTC is appointed which is having representative of medical as well as pharmaceutical stuffs. So why actually the question is that why actually first we are telling here about the PTC? Because PTC or Pharmaceutical Therapeutic Committee is such a committee which is forming the formulary. So see is the second point. In second point it is written the PTC recommends certain drugs to make the formulary as per the opinion of the medical staffs. So PTC actually are making this kind of hospital formulary by the opinion of the medical staff, that is the doctors. Third point is PTC designs the hospital formulary while keeping in mind of the needs of that specific hospital. So first of all, you will see that what kind of hospital is there, and here actually what kind of patients are coming. Fourth is administrative approval is must for implementation of the formulary drugs adopted by the organization. Fifth point is though generic prescription are encouraged, but the physician should have the freedom to prescribe by brand names also. So the physicians are having the liberty to prescribe by brand name also. If there is no formulary in any hospital, the pharmacist have to follow the physician's prescription. So that is a must. So just see the points. These are the actually points. Okay. The sixth point is the medical as well as staff nurse should be informed about the operation of the hospital formulary. Okay, so when new formulary is being implemented, everyone from medical staff to the nursing staff should be informed. 7 point is substitution term should be avoided while adopting a formulary. 8 point is if any changes of the working of the hospital pharmacy happens, medical staff should be properly communicated. Then next point is time to time formulary is revised by the medical staff may be done to consider inclusion of excluded drugs. 10 point is labeling should be done on an adopted format. PTC guides pharmacist about the procedure of purchase. So here actually there should be proper labeling also, and PTC actually is guiding the pharmacist about the procedure of purchase. So in this chapter I have given now actually 5 questions. So two things, that is definition of hospital formulary and what are the formats of hospital formulary. So it is important for actually short question type. Okay, and here actually one type is there, that how a hospital formulary been prepared. So that may also come in short question point of view. And for the broad question, actually 2 questions are important, that is write about the guiding principle while using a formulary and discuss the contents of hospital formulary. So you have to read such like that. Okay, that broad question may come for 5 or 10 marks also. So you have to be prepared like that. Third question is how a hospital formulary being prepared. So here mainly the PTC is having this responsibility. The pharmacist is an important member of this committee. So after deciding for the inclusion of drugs by the PTC, the pharmacist taken the responsibilities for the production, that is printing and compiling the hospital formulary. So mainly after actually deciding that what kind of hospital formulary should be prepared, the pharmacist actually taken the responsibilities for the production of printing and compiling the hospital formulary. Now name or list the format of hospital formulary. That comes under short question. So there are three types: loose leaf format, printed or cyclostyle format, and bound volume format. Number 5 is very important. Discuss the contents of hospital formulary. So PTC is having the responsibility of determining the contents of hospital formulary. So those are as follows. First is prescription. It is an invaluable and aid to the young prescribers. So prescribers actually can follow such kind of prescription formats. So they are very useful for the young doctors. So this section briefs about the parts of prescription, the system of measurement, and essential of narcotic prescriptions. Next point is they are dated, means the prescriptions are actually they are indicating the date, the potency of the drug in written in metric system with mentioned quantity. Then instruction to the patient should be understandable. The repeat instruction to the patient must be written clearly. So these are the data actually what are there in the prescription. And in other data actually normal lab value, weight and measures, percentage calculation, commonly used reagents, doses and milli equivalent. So all those things are mentioned here. It is very important in note you can write, if the formulary is merely an enumeration of drugs which will be used in the hospital practice, then or mere list would be enough. So if actually any hospital formulary is based upon only the drugs which are used in that particular hospital, so hospital formulary, in that hospital formulary the list of drugs are enough, no need of going of other datas. Okay.